two, three. Okay, I think. Okay, so I think we're now live. So everyone, I'd like to introduce to Shahabaz. Shahabaz, welcome.
Hello, everybody. Thank you, Adam. Thank you, Adam. It's a pleasure to be in this live stream.
Shahabaz, I've known for many years, since I first went to Kerala, covered in jewelry, age 20. And I think the first thing that Shahabaz did was show me how to tie the dhoti properly, because I had tied it the wrong way.
Yeah, because that's the basic. Without that, you are not able to practice. So
yes, right.
It's a definite option that you need to have that. Okay, yes.
And Shahabaz is the son, is the third son of Sharifka. So you started when you were 6 or 8, something.
Almost 7 to 8. Yeah, almost.
7 to 8.
I stepped into 7. Started. When you're 7, I'm still a small kid, so you are not doing as serious as someone big. But I started seriously somewhere around 8 or 9. Yes, that's when I really began my practice. Yes.
And may I ask, how old were you when I came in 2001? So how old have you been then?
That's 10 or 11, Adam.
10
we are
or 11.
We are like 10 years apart. So
right. So when I saw
20, I'm 10 years.
So when I saw Shahabaz, I was at that time I was working in the theatre and in dance for a long time, and I went and I saw Shahabaz and his brothers, and the elegance, the control that I saw from them was very striking. So much so that I basically changed complete direction in my life, more or less. So thank you for that initiative, Shahabaz.
Thank you very much.
So since Kalari, obviously you then went on to study physiotherapy.
Right.
And now integrate the Kalari Chikitsa with physiotherapy.
Right. Yes. As Adam said, as Adam rightly said. I mean, let me speak a few words about Adam as well. Otherwise, it will be right on my part not to say something about him. Adam Daniel Phillips, as I know him, is from UK, and he's one of my father's senior student who has been coming with us like past 20 years. And as I see him, he's a very dynamic personality who has a very large ideas on how to do things, how to get things done. Basically, he has a solution for every big problem, I would say, just like my father. Very fiery. Yeah, so he's one of the great students we have ever had, I must really say. Okay. So yes, as Adam has rightly said, after almost my 15 years of long practice, I joined my University of Yanapayagis in Karnataka State, Mangalore, in the year 2011, and I joined my bachelor's course, my degree course for physiotherapy for 5 years. Then I came back to Kannur, back home. So one of the great motivation for joining physiotherapy is, of course, the Kalari and the Kalari treatment, because what I thought was the exercises and the treatment, why, there's a big chance for me to integrate the traditional approach of Kalari and the treatment to the modern exercises and to the modern treatment as well. So if you do that hand in hand, what I could see from my clinical results was that we have got amazing results in almost all cases pertaining to the neuromuscular or musculoskeletal disease. So it was then, after coming back from college, I joined with my father, my beloved teacher as well, and the teacher of Adam Daniel Phillips, who is the teacher of you all guys. And I joined with him in seeing his patients, and slowly I started to improvise and expertise in the field of Kalari Chikitsa with my father, and I was able to. I'm sorry, that's my daughter. Okay. Yes. Slowly, I was able to really improvise and exercise in the field of Kalari Chikitsa, and I gained enough confidence, not to the peak, but enough. Yes. enough confidence so that I can see the patients who are having such problems
Uh-huh.
associated with neuromuscular and musculoskeletal disease.
Yes.
Backed up with exercise. I always back up the treatment with the cardiac exercises. This is the very important thing. I depend whenever there is an issue of, like, let's say simple back pain or knee pain. Most of my rehab exercises were completely Kalaripayattu exercises because I believe, and from my clinical experience, that was the best I could give. Yes.
Yeah. I mean, this is what I found as well, like working with clients, that there is, within Kalari, there is really everything that you need for rehabilitation. And
Right.
if you're selective with what you take from it, you can
Yeah.
really create
Exactly.
you can create a program.
Exactly.
So maybe I can just ask one question, because obviously in the massage, in the Kalari massage, we're working with the energy lines, the nadis or nadis,
Correct.
and
Correct.
and with the acupressure, you're then working on the mama points. So these
Right.
are energetical structures.
Yeah.
So in Kalari treatment, is it fair to say that you're just addressing the energetical body, or is it more that you are addressing both or all?
We are actually addressing both, because if I would say just one, then there wouldn't be really a meaning regarding that.
Mm-hmm.
For example, let's take a simple example, like back pain, low back pain. Low back pain is one of the most pertaining, I would say, a pain that is seen, or a disease that is seen and people, as 80% of human being experience in their lifetime. Someone else or someone or the other, they will have back pain at least once in a lifetime, because
Yes.
as human beings, due to our upright posture, we have certain limitations regarding the support and the structure surrounding it, that leads to back pain. For example, um, at the current scenario, especially, it's not like the olden days where people used to work hard. Everything has been modernized or mechanized. So
Mm-hmm.
there is no much physical strain in for people doing their job. For
Mm-hmm.
example, let's take the womanhood, and the modern women who are, like, at their homes, or even at their office right now. Before, they would need to they would need to use their arms for, like, washing. They would need to have their pulleys and, like, taking the water, or they would
Mm-hmm.
need to grind. So all these involved a very strengthening and strenuous muscular exercises
Mm-hmm.
that literally strengthened their body. It did not
Mm-hmm.
deplete. It did not deplete or destroy their body, but actually strengthened. Which
Mm-hmm.
I feel as a worker in the health field is missing in the current scenario,
Yes.
because
Yeah.
now it has been replaced with automated washing machines. Now you have the
Mm-hmm.
mixers, you have the grinders, you have the you have the electric motor. So everything has been modernized and mechanized. So this
Yeah.
has reduced the human capacity to limit the muscular or the body works.
Mm-hmm. Mm-hmm.
So 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 keeping that at one side. So in the modern era, when people tend to do something as obvious as just like bending down or lifting a weight of 10 kilos, it immediately creates a pop on the back. So that
Mm-hmm.
that has been mentioned by the modern term, like a simple IVDP, or the disc collapse problems. That has been the commonest cause for a simple back pain.
Mm-hmm. Right.
Okay. Okay. So another thing to rule out for, let's say, for back pain is the muscular issue, of course. Like those
Mm-hmm.
who have a really tight muscle, or a spasm back, like, and even that occurs not doing so much, strenuous work. Like once in a blue moon, you try to lift a weight, or you try to grab something. Our body reacts in such a way that it goes for an immediate catch. So a person
Mm-hmm. Mm-hmm.
does not have a habit of lifting heavy weights or during strenuous works, and if he does, like one twice in a year or once in a year, there might be chance that he has problem associated with this muscle,
Yes.
right?
Yeah.
Okay, so these are some of the areas with the pain, how the pain can cause in the human body, and that depends on the job, the
Mm.
mechanical back pain, the way he sits. Like for example, the people in IT field, they sit for a
Mm-hmm.
prolonged duration in such a way that they slowly, as the office starts, they sit straight. they sit straight with the laptops and computers on. Then slowly they tend to stoop down. Then sometimes they are like that. And sometimes they are like that. So the body positions changes the changes the structure and even alters the muscular pull that supports that particular position while the person is in the sitting. It can
And I
also
mean,
cause pain.
that would be a very strong reason for doing Kalari as a kind of preventative measure in terms of
Exactly.
the conditioning, right?
Exactly. So this is where we are reaching to. This is where we are reaching to. So Kalari and the therapeutic aspect and the Kalari exercise aspect has all the systems. For example, the exercise base, we have all the movements that we perform on day-to-day activities.
Yes. Yeah.
For example, where we go when we go for toilet, so you have the elephant posture there. You have the simple elephant posture. So you follow that posture even while going to toilet, or even so even when you're trying to read something or you're trying to get something, you have the horse posture.
Yes,
So
right.
So almost all the day-to-day or the daily activity movements are as exercise seen in coloring. So
Yes,
this is I would call this is a lifestyle exercise and a lifestyle-based treatment.
Yeah, it's very functional from that point of view, actually, because it's these kind of standard movements that we have to make, but obviously like taken a bit more to an extreme or with a little bit more kind of rigidity or
exactly. Yes.
So if I may ask, just a bit in terms of diagnosis. So obviously in Western physio, we break everything down to get a specific diagnosis. If you are approaching a new client that came to see you, complained of pain in the knee, would you be looking to get that same definitive diagnosis at the beginning, or would you be more about perhaps treating the present symptoms that were there?
I mean, there would be a correlation with the 80% of the diagnosis with the modern diagnosis, because only the terms and the terminology changes.
Right.
In olden times we use nadis, and at current we use the nerves or the channels. So that's the only difference we use.
Right.
Okay, so before early times we used the marma points. Now we say like trigger points or the vital points. So both are the same. For example, I just tell you the personal experience. I just got the first shot for my vaccine, the COVID vaccine, and I got it on the muscle here that's called the deltoid. So if the nurse or the doctor gives you an injection straight on the trigger of the deltoid, you might feel the pain for like around 5 or 7 days, because you have got an injection exactly on the trigger point on the deltoid muscle, which if you get hit, there is a possibility that you are not able to lift the shoulder up again. And the best thing is that that's exactly the same point you treat if you want that patient or his or her shoulder to be lifted again. So this is how the treatment and the Kalari exercises come together hand in hand. Yes, right.
So perhaps we can just briefly discuss how we would treat some kind of common symptoms. So if we look at, say, inflammation, pain, and stiffness, which are three things that are coming up, obviously discussed. And maybe the fourth one could be nerve symptoms. But so if we start with, say, inflammation. So if someone came to you with inflammation in the knee, for example, how would you start to bring that down?
Inflammation could be it could be due to many reasons. First of all, it could be inflamed. It could be inflamed due to some kind of any hit or a trauma that he has got on his knee.
Yes.
Okay. For such cases, we have our own traditional way of healing. That we have our own traditionally made anti-inflammatory treatment paste and oils, which are exclusively for inflammation. For example, as simple as like oils like Murivanna. So we apply. The first thing that we do when we have a patient coming with acute inflammation is that we ask the history. If we have any internal issues or a circulatory problem or things related to that, then we would tell the patient to get rectified that first. Right. Or if it is an issue that is connected with the injury that he had externally, then we would go straight for bandaging. In
Right.
that case, there wouldn't be any sort of massage or any sort of trigger releasing that center of the knee, which would actually aggravate the inflammation. So first, our aim is to reduce the inflammation by giving on some sort of bandage that is covered in a paste or oil or Kalari traditional oil. Yes.
So you would use Marmani paste or
Marmani paste.
oil.
You would use Muriwana. Yes, exactly.
Okay. And then once the inflammation has come down, what would be the next thing you might do to move?
Once inflammation has come down, the patient must have the patient should have the problem, the stiffness in the movement, like the range of motion must have reduced. So for that we do knee manipulations, which we have our own knee manipulations. Like we'll make the patient sit on the table. We'll slowly move the knee into the backward and forward position, and we would release all the muscular points around the knee, all the way starting from the upper part of the thigh,
yes,
till below the knee, below the kneecap. Yes.
Yes. And this would be the mama work.
Yeah, this would be the mama, of course.
Yeah.
Of course, yes.
Yeah. Just to clarify for others, yeah.
No problem.
And then what about pain? I mean, so if let's say we come back to the lower back.
Yeah.
So if someone is coming to you with lower back pain, would you be using similar methods or something different?
Lower back pain is actually it's a vast diagnosis, Adam. You know,
Sure.
lower back
Yes,
pain, it's a multidisciplinary approach. There are many causes for lower back pain. A simple low back pain like sciatica or the piriformis syndrome is caused by the compression of the piriformis muscle that's caused on the sciatic nerve, that comes to the sciatic nerve, which passes right below our piriformis muscle all the way down and splits like the tibial nerve and the popliteal nerve and goes all the way down below the knee.
Right.
So in such cases, we would first try to give stretching to the piriformis muscle, and then we would release the piriformis muscle in order to release the compression on the nerve that causes sciatica. That's one.
Right.
Okay. Then the next thing is IBDP. IBDP, the disc prolapse. You know, in the modern term, like many surgeries are happening in IBDP that are actually quite a success, and also many are quite a failure as well. It's not because
just say that once again a little bit slower. Just
yeah. IBDP. IBDP is like intervertebral disc prolapse. You know, our spine, the human spine is actually quite erect. So since we walk upright, we have like around 33. We have 33 vertebrae, and in between we have discs, the intervertebral discs. So due to, as I said before, as I said initially in the class, due to certain movements, like just a sudden bending down early in the morning, or like lifting something heavy, that can cause actually load on can create a load on your spine, and that can cause a protrusion of the disc. Normally that's seen on the lumbar area, like the L4, L5 area. So this is actually quite common. You know, many people know that now.
yes.
Like they say, like, yeah, my L, which the doctor said was L4, L5 area, and that's quite right. But that at that place, most commonly the disc protrusion happens. So for that we have we have our own treatment in the Kalari treatment. In the perspective of Kalari treatment, we give for a person who has had a chronic IBDP, we give around 2 weeks of treatment, and this treatment starts like it begins from the head and we do all the way to the toe. So we first work on the head, then slowly we go to the upper body and releasing all the muscles until we reach the lower body. So we have certain exercises where the patient goes onto his belly and comes up like that. So that causes an extension on the spine, thereby reducing the load on the disc. Eventually, that would go in, that would push back in its original position, causing a reduction in the compression on the dural on the dura or the nerve that passes the spinal cord. So this is one of the reasons, like they have numbness, tingling sensation, things like that.
Yes.
Okay.
Yeah.
So that's another back pain. Now you have back pain that is caused due to on area, like let's say we have a small muscle here right on the back called the QL or the quadratus lumborum. That actually, that itself does not have any pain, but a sudden stiffness or a sudden catch on that can cause such a pain that you feel that it's like a disc pathology or similar to pain of IVDP, or even a pain that is experienced on the sacrum. This is you have our sacrum here in the back, and you have the sacrum ilium, and you have also the ilium there, the right position there.
Yes.
So you will feel that it is an SI joint pain, but actually no. It's actually a pain that is caused with the stiffness or the tightness or the catch that is caused on this small muscle that goes all the way like that. So we have simple techniques to release those, and within a day or two, the patient is absolutely fine.
Yeah, I think this is when Kalari can seem almost like magic, when there are certain conditions which actually there is just a technique which can target it very quickly and directly.
Exactly. So this is why the full body treatment approach is so effective, because you don't leave out anything. There is no because you cannot individualize your body. You know, one thing connects the other. You know, we have the lateral chain, we have the cross chain for the body, we have the front, and we have the back. So each muscle connects. It's like a fascia, and it's like a bag, and each connects one after the other. So if one gets affected slowly in the future, one after the other gets affected slowly. So this is why we have a tradition. The Kalari treatment goes in such a way that we see the body as one, as a whole. That is why we have a holistic approach. Yes, Adam.
Yeah, and I think that's what's coming up now with all this research that's being done on fascia, is that they are getting more and more towards, you know, kind of validating the approach.
Many years back, the doctors were under the impression that it was like separate, but now the research has been done, and now they have come to a point that it's like a single fascia that's covering the whole body. So it's like connection one after the other.
Yeah. Yeah.
That's why we have had patients. We have had patients who, you know, one of the patient who came to my father, when he was trying to catch a train, when he was suddenly holding a train that was just in order to get in, when he was trying to get in, his little finger just hit so badly on the door, which is like iron door, you know. And after 1 year, his pain slowly came up, then it reached this point. And then he had severe pain on the shoulder.
I see.
When this particular patient's history was taken, nothing relevant on the injury he had in the shoulder was seen. So after constantly asking, then finally he told that he had an injury that hit so bad that it was very painful. So then we came to so this is how the Kalari diagnosis happened. You know, if the injury is in one place, the referred pain will be at another area.
Yes.
So that you need to treat the whole arm. At that point, you would need to treat the whole arm.
Yeah. Yeah. Great. And was it? Have you had a good result with this patient?
Yeah, of course. The 80% of his pain was gone.
Yeah, I mean, just just what you were saying before about the sciatic pain. I mean, I think that the treatments that the treatment techniques that I learned from your father for this are very effective. I had one client, she had 20 years sciatic pain, nothing could deal with it. And I did the release I learned from Sharifka, and she had everything go away. Still a little bit of coldness in the feet, but all of the pain was gone.
Right. That's it.
Okay, so maybe just lastly then, how important would you say diet is during the process of treatment, receiving treatment and going through rehabilitation?
Okay. Can you?
Yeah, just in terms of diet. Yeah. So, I mean, are there any kind of guidelines that you would give to people? One or two things, or
yes, of course. One of the main reasons, like you know, I would say, especially in country like India, we use a lot of spice. Spice, I mean, not the exquisite spice, but especially the red chili powder and things like that. So traditionally, when we have a patient come with severe inflammation and pain, we advise the patient to stay away from really hot foods like spicy foods. First thing, we advise the patient to eat that cools his body, like use more turmeric, more coriander, then more fish, and we strictly tell not to eat any sort of red meat or beef.
No red meat or beef.
No beef. No, especially
Okay.
beef. No beef. Mutton is fine. Mutton is fine. Mutton and chicken is fine.
Is that
And all
because of
these,
the heating in the body, or?
yes, of course, of course. Especially chicken at a limited quantity is fine, but too much is also, it's not good because the chicken heats your body.
I
Mutton
see.
is fine. Okay.
Okay.
Then we would give more importance for the patients to have more cooling foods, vegetables, more veggies, and all the food should be cooked in such a way that you don't have any additives or like pollutants or chemicals, stuff like that.
Mm.
Pure as it is. Then we tell the patient to sleep early and not to read much, not to sleep too much during the day, not to walk in the sunlight. Okay, stay away from the relation, stay away from family relations till the 2 weeks of treatment. So the patient follows a particular guideline that he frees himself, his mind from areas that actually really affect him physically, so that the treatment has better effect.
Yes, and the focus.
So if
The
you
focus
consider,
is
yeah,
clear.
yeah. If you consider the diet as such, we would ask the patient to have more veg-based protein like lentils, like chickpeas, leafy vegetables.
Yes, I mean, ideally come to Kerala, right? Come to the academy and receive treatment there.
Right.
I guess your current situation is now you're closed, right? Of course, until things change.
Unfortunately, due to the pandemic, which we are all praying to get rid of soon, due to that, our school is closed right now. And I don't think it will be opening in this year, but in the next year, hopefully, God be willing, we are planning to open it the next year as well. And one other important the opening and we have is that we are planning to open on school even in Dubai. So this is our future plan.
Right, excellent.
This would happen next year or in the year 2023.
Excellent, great, and we're
So
also
looking forward for it.
Yeah, excellent. No, that would be fantastic.
Yeah, right.
I can speak from experience, having spent about 4.5 years, I think, altogether at the school in India, which is now called Malabar Kalaripayattu Kendra.
Kalaripayattu Kendra, exactly.
Yeah. It's such an inclusive and holistic kind of approach to training and to rehabilitation. When you stay there, your food is taken care of, your training is taken care of, everything very much taken care of, so that your focus is very, very direct and obvious.
Right. Right.
Yeah, and I mean, I think I left there about 10 kilos heavier than I am now, so they fed very well. So that's great. Excellent, Shahabaz. Well, thank you so much. Shahabaz is working online, doing one-to-ones at the moment, until the pandemic is down. So please, if anyone is interested in that, you can approach me or you can approach Shahabaz directly. I'll put his Instagram contact. I can say also I'm learning from him online, and it's a very effective way to learn. The transmission is still very possible.
Thank you very much. Thank you very much. And Adam is a very good teacher as well. He learned because he learned from good source.
That's it. I learned from the best. Yes. So thank you so much, Shahabaz. Maybe next month or the month after we'll do this again. Talk about something different.
Yeah, sure.
Nice
thank you very much. It is indeed my great pleasure to have this live stream happen. Thank you so much.
Great. Well, best of luck with everything, and I'll speak to you soon. My regards to your father.
Sure. Bye.